Welcome everyone. Thank you for joining this forum. My name is Jens Ebnet. I'm an active medical doctor and the founder of Ebnet Medical, the expert for next generation vascular access. Yeah, there's a strong connection between cancer and vascular access. It's often hard to get vascular access in cancer patients, and their blood vessels are frequently punctured, for example, during chemotherapy. So reliable vascular access is life-saving, and Ebnet Medical is developing next-generation vascular access devices to improve patient safety and save more lives. It is undisputed that cancer causes enormous suffering. Innovations in this area must be a top priority. While I'm not an oncology expert, I'm passionate about connecting medical professionals with innovative companies to enable need-driven solutions. So it's a great pleasure to welcome excellent speakers. And once again to the audience, please ask questions via Q&A and not via chat. So let's start. Dr. Konrad van Kalken from Excellent Care Clinics will start. We look forward to your talk on inflammation and its role from oncogenesis to palliative treatment.
Well, thank you in the first place for inviting me to this interesting symposium. I've been in cancer research and cancer therapy for, I can now say, for more than 30 years. And I've been asked by my friend and colleague Hans van der Vleckert, who's a member of your group, to share with you my thoughts on the relevance of inflammation actually for the entire process of cancer, beginning with oncogenesis up until palliative care. I would like to take you a little bit with me on this journey where in the past decades the research on cancer has predominantly focused on the cancer cell and the tumors themselves, while increasingly I've come personally with my groups to the conclusion that it's not only the disease process of cancer itself that needs our attention, but also the immunological reactions around the tumor. Over the last couple of years, we have been focusing on treatment of chronic inflammation and acute inflammation with my chain of clinics in the Netherlands, Excellent Care Clinics, and with our biotech spin-off Remicine BioScience, we are developing anti-inflammatory treatment. And I must say, where the primary focus initially was on the treatment of long COVID and chronic inflammatory conditions such as autoimmune disease, we are increasingly seeing cancer patients with fatigue syndromes that actually respond to our treatments as well. So the main topic will be inflammation and its role in cancer, and why we think here that deserves our attention, both for next generation diagnostics as well as next generation therapeutics. When I was a young oncologist, I actually started that within our career frame, we would be able to find a cure for cancer. Well, 30 years later, we must admit and we must see that that progress in our field has been promising. Distinct progress has been made, but for the majority of patients, actually the diagnosis of cancer is made in a too late stage, and for patients with advanced disease, still the outlook for survival is fairly limited, and the actual survival in a period of 40 years has only increased from 1 year to 2.5 years on average. Substantial, but it shows that there is an enormous room for improvement still. And still, patients diagnosed with cancer, only 50% will survive. And we must say, and it's important to state that the 50% that survive is usually patients that are diagnosed in an early stage of the disease, and so our effort should actually focus on trying to diagnose the disease earlier, and we should actually focus on turning treatment into a personalized treatment based actually on the specific situation of an individual patient, as in the order of 70% of the patients are not treated according to the best possible treatment for their personal situation. So ample room for improvement. This is to show that for all the different cancer types that we distinguish, that actually survival increases have been limited over the years. Obviously, we should try and focus on trying to diagnose disease processes earlier. Clearly, we're diagnosing a cancer in a stage where symptoms occur, and very often the disease has already spread. So current technological developments must focus on trying to diagnose these processes earlier without overdiagnosing the patient and our society. That's a major challenge, and that's a process that is happening with current technology. Focus of today is actually on the role of inflammation for the various stages of our disease, and the statement that I would like to make that inflammation, overactivity of the immune system, directing to the tumor site or to places where that are exposed to toxin is actually a key fundamental process in the entire process. This is a schematic representation of what's happening when we expose ourselves to toxin, for instance, cigarette smoking. But important to state is that actually we have only one immune system, and actually the reaction to local tissue damage, whether it's caused by cigarette smoking or other toxins or ways of damaging or irritating our tissue, is actually similar. And because of the fact that if we expose ourselves to toxin, what we are doing all the time, actually what we continuously do is create a continuous form of tissue damage and wound healing. And there is a remarkable similarity scientifically between wound healing and immune reaction. Wound healing creates the formation of cytokines. Cytokines in themselves create a cell proliferation, and obviously if there is continuous wound healing going on in our body, the chances that something goes wrong at some point in time are increasing substantially. In this environment, a cancer can easily arise, and that added to the fact that within an inflamed tissue, the chances that such a process escapes immune surveillance are larger and larger and larger. So that already shows the importance of immunity and immune reactions in the very beginning. But that's not only that. This is to represent schematically the fact that what goes for cigarette smoking also goes for all kinds of different stressors to our body, and all causing through the same immune system, causing chronic inflammation. Of course, very important for causing and for progressing cancer, but the same goes for damage to our nervous system, to our metabolic system, and to our vascular system. Chronic inflammation is increasingly recognized as a key mechanism for chronic disease. And We see, of course, in our current medical systems, we see lung doctors, we see heart doctors, we see people focusing on the gastrointestinal system, but basically all these different specialists are looking at consequences to a large extent of the same hyperactivity of the immune system causing explanation of inflammation and disease. So this is how it's represented in a very simple way for cancer. The inflammation is caused by both genetic and inflammatory pathways. The chances of causing cancer are increased, and that of course creates a vicious circle leading to increasing inflammation and disease progression. So clearly, what needs to be stressed, it's not only inflammation that causes cancer, but it can also cause rapid progression of the disease. It plays a role. I cannot go into the details of all these various sub-processes. It can cause, it plays a role in inflammation, and very importantly, it also plays a role in therapy resistance. And last but not least, it's because of the fact that if our treatments do not work, it also is actually the driver of the disease process in the last stages of the disease, making people very sick. People are sick of cancer usually in the beginning of the process. It's merely the fact that there is a process blocking certain organ systems or whatever, but in the later stages of the disease of cancer, people get really sick, get really painful, feverish, etc., and that's all related to tissue damage and subsequent inflammation. So it's the message should be, it's not only this disease, the cancer cells themselves, but it's the microenvironment, the immunological responses to the disease that actually play a key role in the disease processes themselves. This is a bridge slide to demonstrate that what we found over the years here in the clinic, that when we saw patients with cancer-related fatigue syndromes and neuroinflammatory types of clinical picture, there was this remarkable similarity with new diseases like long COVID, and our clinic focused over the last couple of years not only to study these similarities and the importance as far as diagnosis is concerned on inflammation and fatigue, but we also started to try and develop our immunotherapy focused at diminishing these hyperinflammatory syndromes by repurposing a well-known local anesthetic drug. Excellent Care Clinics is originally a pain clinic, and our doctors had quite a bit of experience with the use of local anesthetic in neuropathic pain, and over time we have taken this neuropathic treatment in the treatment initially of seriously ill cancer patients, and then when COVID came, we used this neuropathic treatment also to treat patients with acute lung problems due to the coronavirus. And later on, when it became clear that a substantial percentage of the patients that had experienced COVID developed long COVID, we have started our repurposing program with this local anesthetic drug to treat long COVID patients. Well, we're in excited times as we have now recently closed our interrupted time series study with this repurposed local anesthetic drug, focusing on lymphatic targeting. So trying to establish a high concentration of the drug in the immune system while keeping the blood levels low with the drug, and the paper has been submitted to top international journal, as we have seen, an extremely high clinical response where symptoms of long COVID have improved across the entire spectrum. So that's exciting times, and actually proving or showing that treating inflammation is possible, and B, that it's also critically important. What we're lacking, and that's what I hope to also get back from your audience, is how we can, with novel technologies, how we can diagnose the inflammation, because current diagnostic techniques are not able to identify a distinct pattern of inflammation among others, long COVID patients, and that is necessary. We have selected the patients on the basis of their clinical symptoms and their clinical story of developing a disease after a COVID infection, but still, to date, a diagnostic test for this specific disease is necessary, or is lacking, and that's very important as we are seeing that our cancer patients suffering from end-stage cancer actually have a very remarkable similar pattern, and actually also show major improvement or similar improvement in their clinical picture when we are treating them with this novel repurposed immunotherapeutic approach. I mean, I realize this is all pretty superficial on a high level, on a very important and frequently occurring medical field. But the message that I have for today is that we should not only focus on the disease processes at the cellular level themselves, but we should really, as far as diagnostics and therapeutics are concerned, also focus on the immune reactions that these processes cause, and that doesn't only go for therapeutics, but definitely should also go for the diagnostics of these processes. I think that's my key message for today's talk, and I'm happy to take any questions. Thank you.
Thank you so much, Dr. van Kalken, for this excellent presentation. There's one question from the audience, from Sarai, saying, great presentation. Regarding the medicinal product, have you seen issues related to agranulocytosis or other forms of immune cell depletion?
No. The answer is no, because of the fact that we have it's our hypothesis that we are not completely blocking the hyperactive immune system, but by blocking a specific chain or a specific pathway, where it's our hypothesis that we are only blocking the hyperactivity of the innate immune system, thereby restoring the balance between innate immunity and acquired immunity. So we haven't seen any issues related to total immune paralysis or whatever.
Thank you so much, Dr. van Kalken. So there's no other question from the audience. One question from my side. What I find truly fascinating is the link between inflammation and cancer. So is there a chance for early detection? So to be very specific, should we routinely focus more on cancer detection when we have a state of inflammation in daily clinical routine?
Well, I think that's an excellent question. Obviously, as far as screening for lung cancer, we are already focusing on people that smoke, that have a habit of smoking. What we're actually doing is selecting people that have a higher chance of having chronic inflammation in their lungs and a microenvironment where the chances of developing a tumor are higher. I would. It's interesting, but obviously there is people that smoke a lot, but apparently have a genetic talent not to develop inflammation and don't get cancer. So actually screening on the level of inflammation would be more rational than just screening on certain lifestyle habits.
Thank you so much. So, Dr. van Kalken, there are no other questions from the audience. Thank you so much for this fascinating presentation.